Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, thank you for tuning in to Back into Alignment. Every Friday, we release an episode related to spinal health to bring you tips to live an optimal life. Today, I'm excited to have again Vanessa Ocampo, who is a rheumatologist here in Toronto, and we are going to be chatting about psoriatic arthritis. We already had 2 talks about rheumatoid arthritis and osteoarthritis. Today, we are dedicating the talk about psoriatic arthritis, and it happens that we do have this weekend an awareness weekend where we are bringing the knowledge about psoriatic arthritis and why this is affecting so many people in the last decade. So Vanessa, thank you so much again to be having your knowledge sharing in a global level. And I actually first wanted to introduce you, so people that don't know you. Vanessa is a rheumatologist here. She's graduated from the University of Toronto. She's a specialist in internal medicine from McMaster University. And currently she's finishing a master in epidemiology in the University of Toronto. She also has a lot of interest learning about inflammatory disease, especially rheumatologic conditions. And she loves to bring approach from a wellness and a holistic level. So that's what I love to have a rheumatologist like Vanessa in our channel, because I think we all work in a unit way. So from emotional to mental health to physical health. So that's what I love to have you here, Vanessa. How are you? Thank you so much for being with us again.
Good morning, Joe. I'm good. Thank you for having me one more time. Thank you.
Yes, you look beautiful. You got a new haircut. You're nice and fresh, getting ready for winter. But first, Vanessa, tell me, how was your week? Like, how is the movement on the patients? Any type of updates that you can give us?
So this week is actually a very interesting week because we are celebrating World Psoriatic Arthritis Day. That is on October 29th. So it is a day where we bring up awareness about psoriatic arthritis, which is a condition that not many people are aware of. And it is very close to my heart because I did in rheumatology, and then after I finished rheumatology, I have extra training in psoriatic arthritis. I did a 3-year fellowship on that. So and there I learned that not a lot of people that actually have psoriasis, which is a condition of the skin, a lot of people don't know that they can actually develop problems in their joints. So today, it's a day where we make the disease visible to the world.
Okay, so as you were saying, I heard about psoriasis before, and we tend to see a lot of flare-ups when we have certain foods. Psoriasis can show in your skin, but psoriatic arthritis perhaps it's not a common terminology. So we would love to know about what psoriatic arthritis is as a chronic inflammatory arthritis. And as I was researching, it's actually coming in a higher level. We're talking about that psoriatic arthritis can occur about 3 every 10 people that has psoriasis can actually evolve into this inflammatory issue. It may cause pain, stiffness, and swelling in person's joint. Again, it's arthritis, which is, again, arthritis is an inflammation. And it can actually now affect not only women but men. So tell us a little bit about psoriatic arthritis. And I know you were just saying that you have 3 years studying more about this specific condition. And tell us more about this so we can learn from psoriatic arthritis and how we can prevent it.
Yeah, so psoriatic arthritis, as I was saying, is a disease, is a type of arthritis. It's one of those big inflammatory arthritis that happens in people with psoriasis. So psoriasis, for those that don't know, it's a skin condition where people get plaques in their skin, and they're flaky. Sometimes they look like silver looking plaques. People could have it in the scalp, and sometimes it can be misdiagnosed as having dandruff. Um, Most of the time, they people have behind the ears, in their navel, in the intergluteal area. And some other people could have psoriasis just affecting the nails, which is an important thing to know, because those people are very prone to have psoriatic arthritis. So, as you were saying, about 30% of patients who have the skin condition would develop the problems in their joints. Um, it could happen that you have the skin condition and then you develop the joint disease, or sometimes it happens that you first develop the joint disease with a specific pattern, because there's a pattern for the psoriatic arthritis, and then years later you develop the skin disease. And that one is a difficult one to diagnose, but I've seen it. And then there's other type of patients where they have at the same time the skin and the joints involved at the same time. Most commonly what we see is that we see the skin and then the joints. Years before, when I started my training, um we were used to be taught that you have the psoriasis, and 10 years later you develop your joint problem. Nowadays, with research, we know that that is not true anymore. And we know that at any time, any point in your disease spectrum, you could have the joint affected. It doesn't have to be that after 10 years. It could be 5 years, 2 years, 6 months. And as you were saying, it's been more and more diagnosed, but I think it's because we are more aware of the disease. We're making people aware of it, where people are more like, oh, I have this, so maybe I could have. So, and doctors as well, like especially the general practitioners, will be working a lot with our family physicians, um, making sure they know what to look for in these people, so they send it to us, same as the dermatologist.
Mm-hmm. So you're saying that people that are experiencing psoriasis, they actually have a higher level to have of arthritis, psoriatic arthritis.
Yeah.
And but not everybody that has psoriasis will develop.
Not everybody.
Right.
Yeah. No. And that's a very important thing to know, because, we all age. And as we all age, our joints tend to ache when we're aging. And as we age, we also can develop something called osteoarthritis, which is the wear and tear of your joints. So if you have psoriatic arthritis, if you have psoriasis and you start aging and then you start aching, obviously you're gonna be, now that you're listening to this and you didn't know this disease exists, you'll be like, oh my god, maybe I'm not just getting old, maybe this is psoriatic arthritis. So sometimes it could be a little bit tricky, because psoriatic arthritis presents in the distal ones, in the ones that are like these little ones. Most commonly can affect this ones and this one, but most commonly we'll see here. And the osteoarthritis, the wear and tear, also affect these ones. So sometimes it could be a little bit tricky. Sometimes they can be both present at the same time. But we look for other things in the presentation of psoriatic arthritis that help us kind of like clue into, is this really psoriatic arthritis or not? So I don't know if maybe we can talk a little bit about the symptoms so people are more aware.
Let's say if somebody has the kind of like a ring around the hairline, and it has psoriasis around the hairline or in the bottom by the skull, where the hair starts growing, that person has psoriasis. Would that make sense to check if that person has psoriatic arthritis, if it starts feeling the swelling or like joint pain, just to like discard that possibility?
Yeah. So we always said, like, the first step is to make sure you see a dermatologist, a specialist in the skin, so they can confirm that you have psoriasis. So once psoriasis is confirmed, and then you start having joint symptoms of any nature, it is always good to tell your dermatologist or your family physician, to send us to us. So we're always happy to see everyone with psoriasis who develop joint symptoms, because as I said, sometimes it's difficult to say, is this just a mechanical problem, or is this really an inflammatory problem that has to do with psoriatic arthritis? Um, People with psoriasis could develop rheumatoid arthritis as well. Some people have psoriatic arthritis and they also have rheumatoid arthritis. Like, there are many things that could happen. So it is always important to get checked out. Like, it's
What are the tests that are done to be detecting psoriasis? Just psoriasis. Is it like a
what are,
blood test? Is it a skin test, or how is it?
so it is mostly diagnosed clinically. So dermatologists, you will go and they will look at the plaques that people develop, and they look with the special lens that they have. Um, Sometimes it could be tricky to diagnose the psoriasis, especially when they have it only in the scalp. If the scalp is just like flakes, and it could, some as I said, it could sometimes look, people just say, oh, I just have a really bad dandruff, and it's not that. So sometimes it could be tricky. um but most of the time the plaques are like raised, like you can see, like you see the skin, and then you see like a plaque and it's raised, and it tend to be very scaly, and it's silver looking. Like, the typical psoriasis plaque is silver looking with a redness to it as well. Like, it's like the bottom is like red, and it has like little flakes on top that are like silver looking. There's no specific test for that. It's more a clinical diagnosis, and the dermatologist will look for the most common sites. So, as I said, behind the ears, in between your buttocks, in your navel. They look at the nails. The elbows are also a common place. The knees as well. And there are many types of psoriasis. It's not only one psoriasis, but I'm not a dermatologist, so I'm not an expert at that. But what I'm telling you is kind of like the general idea of what psoriasis is. There is no a blood test for that. Sometimes when it's a difficult diagnosis, and they're like, oh, maybe it is, maybe it's not, they could take a sample, and the sample could confirm what they're saying, what they're thinking it is. But most of the time, dermatologists are so good at that, they just look at it, they're like, yeah, this is it, or yeah.
And so then somebody that already is diagnosed with psoriatic arthritis,
Mhm.
I heard that it not only affects the skin, but also could affect organs. Can you please explain a little bit about what organs does psoriatic arthritis affect?
Yeah. Okay. So, I want to say before going there, so psoriatic arthritis could affect the musculoskeletal system, meaning the joints, the bones, the muscles, and we call it extra articular manifestations or extra musculoskeletal manifestations, which are the manifestations you're saying. So, just to know what things in the musculoskeletal system psoriatic arthritis affect. So it is not only the joints, it also affects the tendons. It's very important that people know that. So people who have something called tendinitis, people who also have something called enthesitis, which, for example, people, the Achilles tendon, they could have, that's a typical one that people are not aware of, and it's important to know that people start having Achilles tendinitis, and they have psoriasis, that people don't just relate one and one. They just think, oh, it's just my tendon. But that could be a presentation, especially in younger people, than when they play golf or where they play tennis. I've seen it a lot in people that play tennis, and they're like, oh, it's because of the tennis. But it wasn't. It was because they have psoriatic arthritis, and they just don't make the connection. They just think it's only the joint. As I said, the nails. So psoriatic arthritis could also affect the nails, and people are not really. People say, "Oh, this is just my psoriasis," but having nail disease in psoriatic arthritis, it actually help us to be more aware that those people who develop erosions or damage to the joint much faster and worse than people that don't have the nail problem. Um, Other thing important is that it could cause something called dactylitis, which is the sausage digit, and it's called the sausage digit because you look at the joint at the fingers, and they look like a sausage. It could be your fingers, it could be your toes. So they're kind of like the musculoskeletal part. It could also affect your spine. It could also affect your sacroiliac joints. So it could cause something called sacroiliitis, which is the inflammation of their sacrum. That's another important one to know. And then when we talk about extra musculoskeletal conditions, so one that I also study a lot, that I liked a lot, it's called uveitis. It's not that common, but it's about 8% of patients with psoriatic arthritis. It's more common in other type of inflammatory arthritis, but it could be seen in those patients. So the inflammation of the eye. It could be one eye, it could be both eyes, it depends. People could also have problems heart problems. So what type of heart problems? So one important thing to know is that these patients with psoriatic arthritis, because it's an inflammatory disease, they have increased risk to have cardiovascular conditions, such as having high blood pressure, problems with the cholesterol, more heart attacks. And it's not only the disease is per se, it is like everything that is related to the inflammation of your body. Because remember, you're sitting in your joints, but it's your whole body that is like playing a role in the inflammation. So people have increased cardiovascular risk factors. Some other people who have associated bowel problems. So we always ask patients if they have bouts of diarrhea, if they have diarrhea with blood, because people could have this problem and have inflammatory bowel disease at the same time. Rarely could be an inflammation of the vessels of the heart. That's rare, but it could also be seen in those patients as well.
Okay, so it will affect the skin, but it will also affect the eyes, the heart, the lungs, the GI. So it's actually can affect us internally. From a point of view, from a holistic approach, where we always talk, what would be the effect of perhaps having a nutrition that can actually support us in the way of healing? Now, looking into the solutions, if you already have diagnosed psoriatic arthritis,
Yes.
there now you're looking into the solutions, starting from the movement, which we already talked. Motion is lotion. That's a
Yes.
good thing to do. Supervise, especially if you are suffering arthritis, we need to have supervision, avoiding those high impact movements and staying with the walking and then keeping the muscle retention. What other changes we need to do in our lifestyle to be able to live a life that still is at our best, still having psoriatic arthritis, especially with the GI inflammation? I guess we have to be extremely careful with the nutrition.
Yes. So the so-called anti-inflammatory diet, which has a lot of components of the Mediterranean diet, it's one of the good things that people could follow in terms of helping their bodies to have less inflammation. And it's interesting that you mentioned that because there's been about 2 years now, I think, at the Women College, one of the doctors there, she's doing research on the impact of diet in psoriatic arthritis patients, which she's seen like when people eat more like a cleaner diet, and it doesn't mean that you just need to buy expensive things or things that no, it's just like a regular good clean diet rich in vegetables, fruits. And one important thing is there's certain categories of food that are being classified as being pro-inflammatory, but it is always the thing that I always tell patients is like not everything is the same for everybody, right? what could cause inflammation to you, it couldn't cause anything to me. So it is important just to be aware of what are those type of food that could lead to inflammation, and you could work with someone like a nutritionist that like specialize in inflammatory conditions, and you can kind of like, you know, just you see what causes, what doesn't cause inflammation, and slowly you can just like find better ways of eating, because you know, like you need to have a proper diet, even if you don't have psoriatic arthritis, for anything. Like if you want to be a healthy person, like diet is the first key that you need to do. So diet, exercise. So important things is that when people are aching and in pain and inflamed, obviously you don't want to exercise because you ache. But once the flare is better, I always encourage patients to find a physiotherapist that can guide their exercises, so they can learn how to exercise properly so they don't damage their joints. It is important to have proper muscle so you can actually have a good joint health. So if you have good muscles, you will have good tendons, and then those tendons will be able to keep your joints in place. So it's always important to, for that. Calcium and vitamin D, it is also important, you know, to promote bone health. Um, it doesn't mean that you have to take vitamin D, you have to take calcium, but we live in Canada, so we don't get this time of the year, we don't get good sun exposure. So we're from South America, so our vitamin D levels tend to be good, but a lot of our Canadians, they actually are low in vitamin D. So if you are, then you should take supplements for vitamin D. If you think you cannot supplement the levels of calcium, the amount of calcium you need with your diet, well, then you'll have to take calcium. Um, what else? Oh, one something important thing that I wanted to just remind is that a lot of the patients who have psoriatic arthritis, they can develop depression. It's so common, so common in patients with psoriatic arthritis. So it's been said that about 1 in 10 people that have psoriasis and psoriatic arthritis are diagnosed with depression. So it is so important as part of the therapy that they have that support for the mental health part. So exercise help, but having, I don't know, a therapist or a psychologist, or just talking to your family physician, having that support for depression, it's crucial. Because if your patient is depressed, the disease is going to be even worse.
Totally. Just always a way to understand that our body, it works not only as physical but also mental and emotional. Especially when we eat food that nourish our body, we tend to feel better and great. And also when we're moving, we're developing all this hormone cascade of hormones that actually can make us feel more balanced. Very important. Vanessa, if somebody is confused between lupus and psoriatic arthritis, could you just take us very quickly about the difference between lupus and psoriatic arthritis?
So they're very different, very different. So lupus is also a systemic disease, okay? But lupus tend to present in patients with, so it doesn't have to do anything with psoriasis. Lupus is a systemic disease that is more common in women. It's rarely seen in men, but it could be seen in men. It affects most of the time women in their childbearing age. People with lupus have other, they also have skin manifestations, but their skin manifestations are a little bit different from psoriasis. So they tend to have something called malar rash, which is a rash that is like a butterfly rash, and that rash spares this folds over here, which is very typical of that rash. And they have something called photosensitivity, which means they go out in the sun that rash tends to get worse, and the skin tends to burn much easier. And they also have some lesions in the skin that can be developed. Whereas people with psoriasis, when they're summer, their psoriasis get better when they get exposed to the sun. That's why people with psoriasis, they have UV light treatment to treat the skin. If you put someone with lupus under UV treatment, oh my God, that's gonna be a bad flare of lupus, because actually the sun can induce lupus, like a flare of lupus. People with lupus could also have joint involvement, but the joint involvement is lupus is not. It could be really bad. People could have bad inflammation, but most of the time it's not as horrible as you see people with psoriatic arthritis, where their joints are like huge and they're inflamed and they're in pain, and they're something different from um, psoriatic arthritis versus, for example, rheumatoid arthritis or even lupus is that so rheumatoid arthritis, as we spoke before, it tends to be symmetrical, meaning, like it's like a mirror, like, yeah, these two and these two at the same time, and both of your wrists or both of your knees. Whereas psoriatic arthritis tend to be most asymmetrical, meaning, oh, maybe this one or maybe this one or maybe this one, like they're not at the same time. It could be symmetrical, but most of the time it's asymmetrical. So that's also an important difference. People with lupus, they could also have extra articular manifestations because it's more common. Like the arthritis is not the main issue in lupus, so they tend to have more problems with the lungs. So the cover of the lung, the pleura, if they have inflammation of that, they could have inflammation of the heart. Not the heart itself, like the cover of the heart, the pericardium. So they have pericarditis. People with lupus tend to have, when you look at the white blood cell, they tend to have lower white blood cell count. They tend to have lower platelets as well. They could have oral ulcers and nasal ulcers, which it's not something common that you see in people with psoriatic arthritis at all. And they have something called the anti-nuclear antibodies. They should be positive in people with lupus, whereas it has nothing to do in patients with psoriatic arthritis. Like we don't even look at
Okay.
that.
So it presents some of the symptoms similarly, but it seems like it's way more complex, the lupus.
Oh, lupus it's a very complex disease. Like lupus will require a longer talk, because lupus is it's called the disease of the thousand faces, because it presents in so many different ways. And sometimes it's hard to diagnose because it could present in the ways that you're like, oh my God, this was lupus. Um, so yeah, it's different. It's very different. We can talk one day about it if you want. It's a very interesting disease, especially because it's so common in women. So yeah, but it's different. It's different.
Well, yes, we learned so much about psoriatic arthritis today. We even go deep into the comparison with lupus. And as I understand, psoriatic arthritis is something that it has to be treated from all levels, starting from our mind, commenting that there is actually a correlation between depression and psoriatic arthritis. And then because it could affect your GI tract, then we definitely have to take a look at our nutrition, having a proper approach with the anti-inflammatory nutrition, which is very close to the Mediterranean diet. And of course, having a daily routine supervised to move our body, because motion is lotion.
Yeah.
So yes, thank you so much, Vanessa. You have definitely compiled a lot of information from your last 3 years of experience. And my last question to you will be, if somebody is diagnosed for the first time, very new, and is a little bit overwhelmed and definitely feeling hopeless, what would be the number 2 steps to start into the healing journey of psoriatic arthritis?
So I would say first thing is to work along with their doctor. And I mean by that, having a good rheumatologist and their family physician, and follow the instructions, take the medications properly. As much as I believe that you should exercise, eat well, and take care of your soul and your body, you should also be diligent and take the medications, because there are things that all that holistic part wouldn't help with the, to help with to conquer completely the inflammation control. So I would say number one, work along with their family physician and their rheumatologist together to follow all the instructions as they have to do, that they have to do or follow. And second, I would say, remember, as you said, it's not only about the body, it's also about the mind. So meditation, reading good books, painting, whatever works for that person, do it. Okay? Because I do believe that, as I said, I think one and two, what I'm saying is that one and two, that these two things to me are just so important, that if you follow those two things, probably you'll do good. And I think the main reason why I said it's important to have a good rheumatologist on your side is because, as you said, people are like, oh my God, am I gonna die? Am I gonna become crippled? Am I gonna be able to work? So if you have a good rheumatologist that can sit down with you at least the first time you're diagnosed, and you can ask and have answer to all those questions, and followed properly with the management, I'm sure things are gonna, you know, do good. Like, it's sometimes we have patients that they're difficult to treat, and we usually have like a guideline for management where we start from little and then we start like escalating if we need. And that's why it's important to be with someone that knows about it, because there's a protocol that you should follow to have access to a specialized medications. But before you get there, you need to start with 1, 2, 3, 4 in order to get there. So that is why it's so important to have the specialist on your side, so you can be followed properly. We do have a really good psoriatic arthritis clinic in our city. It's at the Toronto Western Hospital. And I do send my patients there because I want them to be linked with their clinic, because they do research there. So I like them to be involved in that. For example, the Mediterranean diet research for psoriatic arthritis, is in there. So if they can participate of that, benefit from that, that's great. There are a lot of people that have difficult to treat psoriatic arthritis, and they do a lot of research, new medications. So if they're there, they can be exposed to that and have that benefit. So I usually tell them, I could be your rheumatologist. You have me here anytime you need me, but at least once a year, I like them to be followed there, so they have the access to all other things that they won't have in the community. So people just should be aware of that, and just tell your family physician or to your rheumatologist, and you send me there at least once. They can assess me, and then, because it's always important to have that extra support.
Yeah, totally. And be part of a community, and like you say, a community knowing that you're not alone. I know there is a lot of shame when we actually having a skin health condition, because when we have a skin condition, our skin is actually the way as we present ourselves, right? So if something is flaring up in front of our head or is visible, we tend to definitely develop mental issues, as we don't feel comfortable in our own body. So we wanted to remind you that there is a community on the Western Hospital. We do have Vanessa, who is in Toronto, so please reach to her. Vanessa, I'm going to add all your content in the chat to reach to you on Instagram, so you can actually be in contact with her if you need her. People have been asking me about you, so I told her, yeah, you can definitely contact Vanessa right away and try to book an appointment with her. Are your treatments covered on all hip?
So yes and no. So it depends of your age. So if you are over 65, and so you're most of the time, the OHIP will cover your medications. If you're under 65 and over 25, there's something called Trillium that you apply to, and that's because you don't have the means to pay for your medication. So the medications can be covered. If you have a private insurance plan, the private insurance, if it has medication coverage, then yes. If you're in the hospital, hospitalized for any reason, or hospitalized for, I don't know, a really bad flare or infection or something like that, obviously everything will be covered. But then it comes something important, that in our conditions, including psoriatic arthritis, there are medications that are thousands of dollars a month, and those are the biologic medications. So if patients have private insurance plan, there are ways for us to ask the insurance to helping us covering that, because there's even millionaires will be hard to pay a $25,000 monthly or every 2 weeks. So then we apply for the medication and we explain why we need the medications. And that's why I was telling you there are steps to get into medications, right? And if the insurance plan said, no, I'm not going to cover, or people don't have private insurance plan, so we manage ways of asking the government to help us, and the government most of the time help us. And if we cannot get the government to help us, so there we have something called compassionate access, where I literally just ask for compassionate drug coverage to the company that does the medication. And somehow we get people the medication.
Okay, nice. Well, okay, I guess it's a whole process to be able to reach to the medication. And what would be the typical average of expense in the medication for someone that has no coverage?
Well, as I said, it depends, because you could at the beginning, you could manage. Some people can manage just with anti-inflammatories. So an over-the-counter Advil, an over-the-counter naproxen will do it. But that's one spectrum of patients. And then there are other medications that are called DMARDs, which are, for example, methotrexate, which is not that expensive. It depends the amount of money you can spend of that. It depends if there are injections or if it's pills. So it could alternate between, like $200 to $300, $400 monthly. But then when we enter the biologic part, we're talking about thousands of dollars. Like it is incredible the amount of money that this medication costs. Thankfully, these days we have something called biosimilars, which are medications that are not this famous drug names, and they're called biosimilars, so meaning they're similar to the initial biologics created, and they're less expensive. So thanks to that, people have more access. I couldn't tell you exactly the amount of dollars that people will spend monthly, because it depends on the different million biosimilars we have. They're cost differently, and it depends how we're using the medication, because sometimes we use it weekly. There are other medications that are used bi-weekly, or every 2 weeks, or once a month, or every 6 weeks. So it is different, but I can tell you it could be thousands of dollars. Yeah.
Okay, well, this is very complex, and it's important to explain this part, because I know when we are talking about finances, we can see that health is wealth. So that's why we have the first approach, which is always the natural approach, finding lifestyle changes, and then we definitely have the pharmacological that is pricey, and it may take process to be able to go into all these programs that you commented. But thank you so much, Vanessa. It's been a pleasure to have you again on this podcast. And I'm sure there are a lot of questions coming from our audience. Please reach to Vanessa, reach to me. We're going to be supporting your journey, knowing that you're not alone. There are tons of communities supporting arthritis, as is one of the number one autoimmune issues happening. We're talking about 1 every 5 Canadians have arthritis. And we're talking about a projection of 9 million of Canadians by 2040 suffering of a type of arthritis. So thank you so much, Vanessa. Have a beautiful weekend. We really love to have you, and I can't wait to have you again. So have a beautiful weekend. Thank you so much.
Thank you, Joa. Take care. Bye.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.